Good morning, friends and fellow colleagues. I hope you're all healthy and washing your hands. Wow, what a time to be alive. Since I can remember, we always fear the effect of a virus on our computers. Damn, we just never thought of uploading that antivirus into our world. House arrest without a criminal offense. Who would have ever thought? Guys, we're all in this together, and I believe we will rise stronger together. So thank you very much for your time this morning and for investing in your careers in times like these. What I'm going to do now is I'm going to switch over to my PowerPoint presentation. It's only 5 slides. The bigger purpose of the presentation is really to demonstrate to all of you how to insert an Optragate. So I'll be inserting an Optragate on someone. The slides is just a little bit more of a background explanation. Paula's also recording the presentation, so if you're wanting it afterwards just for like practice purposes or to show your assistant or to teach the oral hygienist that's maybe not logged in, please get hold of us. We're more than welcome, more than willing to share that with you. Okay, so let's get started. Here's my presentation. Okay, the big question all of our minds this morning is why an Optragate? I hope that all of you will think of isolation differently. My best friend and fellow colleague definitely has the best opinion of an Optragate. She says a dentist without an Optragate is like a blind man without his Labrador. And we must never forget our Labrador. Optragate is a latex-free lip and cheek retractor for the effective isolation. Its unique flexibility and elasticity makes it comfortable to wear and assists patients in keeping their mouth open for a prolonged period of time, benefiting the efficient treatment procedure. Optragate gently and evenly retracts the lips and cheeks for a focused and efficient treatment procedure. There's no need to additionally use your mirror to retract the cheek. So ultimately, you've got 2.5 hands if you've got your Optragate in place. There is absolutely no aesthetics without isolation. Adequate isolation is absolutely critically essential for the successful placement of all types of adhesive restorations. Often, relative isolation in the case of an Optragate is already sufficient to achieve good results and patient acceptance. Irrespective of whether you're placing a simple composite restoration or adhesively cementing a ceramic restoration, Optragate is an effective and efficient aid and forms a sound basis for the long-term clinical success of that aesthetic restoration. Effective isolation, while at the same time helping to raise your efficiency. Clinical trials were done on an Optragate with a picture on the left-hand side of the page, and it's thought to be that the efficiency of each treatment procedure is up to 10 to 15% faster when you've got your Optragate in place. Ultimately, good results equals high satisfaction and equals a good reputation. On this slide, you'll see that we've got the white Optragate on the left-hand side. That is for relative isolation. And relative isolation, I mean, we're retracting the lips and the cheeks, but we're not doing anything to the gums or the gingiva and the tongue. We've got a solution for that as well. Our OptraDam version of the Optragate is absolute isolation. What that means, I'm retracting my lips and cheeks like with the Optragate on your left-hand side, but I'm also retracting the gums and the tongue, and that's absolute isolation. There we go, one slide. And the best part of everything, an Optragate is literally applicable for any indication in dentistry. A simple checkup might be a little bit of an overkill, but if you are taking photographs, that's absolutely great. Practices these days are scanning just about every patient that walks into the door. So ultimately for a checkup, that's great. When we are adhesively cementing any restorations, ideally, we would like to do absolute isolation, which then falls back onto our OptraDam. But sometimes there are cases that it's just super difficult to get your rubber dam in place. Then we can at least fall back onto something like an Optragate, which is at least some relative isolation. Direct restorations, those class 5 restorations, that male patient, 50-year-old, that's been brushing his teeth with a hard toothbrush all his life, and he's got big craters from his 3s down to his 6s. If you put an Optragate in place, you can do those restorations super easy. While we are on this picture, I just want to show you that's called an OptraSculpt. An incredible composite restoration. Some dentists believe that they'll leave dentistry if they can't use an OptraSculpt. Orthodontics brackets. For pediatric dentistry, it's super successful. You also actually get the Optragate in blue and pink. So for the pediatric patients, you can always give them the option to choose between a pink one or a white one or a blue one. This gives some authority or some power into their hands, and they feel that they are part of the treatment rather than just receiving the treatment. With bleachings, I mean, it's really, it helps with any clinical application. I just want to exit my screen here for a moment. Before I go onto the demo, I just like to put some things into perspective for all of you. So at Ivodent, you'll also see on our logo, you'll see our motto is adding value to our business partners. And ultimately, we are all business partners in this bigger sphere of things. So we so often shy away of the money talk. But let's talk finances. Let's talk finances into your pocket. Cost of the Optragate is roughly 25 Rand. So whether you are working in a medical aid, high-end aesthetic, or even specialist practice, if you're charging an 8304 code, which is the code for isolation, you are getting anything between 100 to 350, maybe even in a specialist practice, up to 400 Rand. So charging 8304 gives you between 100 to 400 Rand in your pocket. And the cost of an Optragate is only 25 Rand. So if we do the simple maths, like we all learned in grade 1, you will realize that you are earning 75 to 325 Rand pure stress-free profit per Optragate you are using. This is a no-brainer, guys. If you only use Optragate on 5 patients per day, you can earn up to 375 to 1,625 Rand pure stress-free profit per day. Say we only work 20 days a month and we use an Optragate only on 5 patients per day. You can earn anything between 7,500 to 32,500 Rand profit stress-free. No comebacks, no debondings, and no sensitivity. I can see you all smiling, and I can promise you, your patients will sit and smile in your chair, whether they want to or not. And ultimately, I can guarantee you that your dental assistant has already started smiling when you bought your first box of Optragate. So, to be honest, I'm lucky enough to be dating a dentist. So I'll be doing the demo right on him. But before we get onto the demo, I just want to put one slide up onto your screen. When we take an Optragate out of the box, you'll see that there's a line drawn on the little packet of the Optragate that indicates junior, small, and regular. Those are the 3 sizes that an Optragate comes in. When you fold the packet double, I'll show it up on my screen again when I do the demo, but just so that we see it in a slide and everyone's on the same page. If you fold the little packet double on that line, you can actually insert it into the patient's mouth while at rest and measure from corner to mouth to corner to mouth. But to be honest, majority of patients are small periodontists that are more interested in the gums than the tooth structure per se. All love the regulars. I've even got a periodontist up in Johannesburg that believes he wants an extra regular. So for the periodontist, the regular is the size to go for. And then obviously for the kids up to around 12 years, a junior is absolutely perfect. What's nice about the junior, if we've got patients with super small mouths, we can even utilize a junior Optragate for them. Okay, so let's do the demo. So I've actually got 2 packets of Optragates here. The one that I'm showing up on your screen now, you'll see is a small. So it's got a little S at the top corner. The regular packet has got a regular right there. Okay. If I turn the packet upside down, you'll see the little line that I'm showing you now. And if we fold that line double, we can put it in the patient's mouth and measure corner to mouth to corner to mouth. Okay. If I actually open the Optragate, and take it out of the packet, it looks like a piece of rubber, but you can ultimately pull it apart, and it looks like a little pipey type of a rubber cheek retractor. You'll feel that you've got a hard inner ring that goes onto the inside of the mouth, and then you've got a thinner, finer ring that goes on the outside. If you have a look up on the screen, you'll see that you've got these little tags at the bottom of the Optragate. Now, those tags indicate the outside bottom of the Optragate. Just going to pop David up the screen here.
Good morning, everyone.
You can make up a little bit. So when using an Optragate on your patient, obviously this is rubber. They are super nervous. Their mouth is dry. Their lips are dry. And we're not going to fit this into their mouths. Using Vaseline is an option, but it's an oil-based product. So you're going to be lubricating everything. Some guys tend to use glycerine. That is exactly the same as Vaseline. It's just a water-based. Doesn't interfere that much, and you can really just rinse it around. Personally, I prefer using a little bit of water. It's the easiest. I just take my 3-in-1 syringe and I just drip a few waters around the side of the Optragate. Actually got a glass of water here so that I can just show you. So all I do is I literally just put a little bit of water around the sides of the Optragate. So the technique that we will be using is I'm going to hold my Optragate to the side with the tags pointing towards me. So this is the front, that is the back end. I will then insert my fingers from the front of the Optragate and grab a figure of 8 onto the back ring. So if you have a look on your screen, you'll see that I'm grabbing a figure of 8. I'm going to pull my fingers out again. So I've got the front ring and I've got the back ring. And what I do is I put my hands in from the front and I grab the back ring. I'm not grabbing the front ring. It's not going to do anything. I grab the back ring at the back. Before I go onto the demo, I just want a little bit of technicalities. So when a patient is opened up wide, you'll also feel that the lip pulls very tightly over the teeth. So nothing can be inserted between the upper lip or the lower lip and the teeth. So in order to insert it or position it properly, the patient actually has to close down. So I'll do the little demo on David. So screen a little bit. So start from the beginning again. I've got the Optragate in my hand. The front pieces are pointing downwards. I grab a figure of 8 through the back. There I've got my figure of 8. Now I ask my patient to open up. He opens up. I hook this left corner into his left corner of his mouth. I then pop the right corner into his mouth. And then I ask him to close down. When he closes down, the Optragate just pops in between his lips and cheeks. And there it's in place. Okay, great. I'm just going to take that. When we take it out, always have a little tissue in place because there's quite a bit of spit and saliva that comes out. So I'm going to take it out of his mouth. I'm not working with gloves. But at least I know where David's mouth has been. So it's pretty safe. So let's demonstrate again quickly. I've got my hard stiffer inner ring on the outside. I've got my soft ring on the front with my tags at the bottom. I then grab a figure of 8 onto the back ring and I insert it into his mouth. I then put it in on the left-hand corner, in on the left-hand corner, in on the right-hand corner. I let it slide in while he's closing down, and there he's got his Optragate in place. Thank you very much. There we go. Any questions from your side?
Okay, Stephanie, I see in the chats we've got Martin has asked, is the 8304 is stipulated for OptraDam?
Yes, correct. It is stipulated for isolation, OptraDam isolation. It has been proven that our Optragate is a form of relative isolation and is adequate to charge the 8304 code. Checked it.
And then Dr. Makanji said, I have had 8304 rejected by GEMS.
Yeah, GEMS is a medical aid provider. I mean, we can take the medical aid chat out afterwards. I'm actually not personally sure. I've never worked in a medical aid practice, so I'm not too sure how the claims work. You will have to clear the codes that you are able to charge with your medical aid. That being said, if you just set the cost of isolation at 25 Rand, you might not be making money out of your isolation, but you are increasing the long-term success of that restoration. We all want to use resin materials and throw minimal invasive and do veneers and nice high-end transfer, silicone transfer composites into the mouth. But the one thing our resins don't like, and the one thing we don't always respect about them, is the fact that they don't like moisture. If they get contaminated, they're not as strong as they should be. They don't last as long as they should last. And yeah. Let me see, why no gloves? And then you wipe your hair. Okay, perfect. I've actually got my gloves here. Is there any further questions? Anyone wants to ask something? Anyone that would like?
Hi, Stephanie.
Yes, good morning.
Morning, how are you?
Good, thanks, and you? Yes.
Not too bad. Yeah, long time I haven't seen you, eh?
Yeah, I haven't seen you for a long time.
The question from the 8304 code by GEMS, it's not that they've rejected it, they've actually stipulated with regards to the tooth numbers involved, and that's where the rejection has come from. So even though under my root canal treatments, where I've stipulated that I've obviously placed a OptraDam on that tooth, that's been completely rejected. So that's the complete use of a proper OptraDam clamp, all of that's not even the partial isolation from Optragate. So now, in this case, how are you going to do that? If they do question you as a tooth number for the isolation, what are you going to do for Optragate?
Yeah, I mean, you should charge the code that with a particular tooth that you are working on. So you can't charge for a tooth number that you didn't restore. So if you're working on your 1/6, then you charge the isolation onto the 1/6. Or if you're placing a veneer in the anterior region, it goes through with the teeth that you did treat during the procedure.
Okay, yeah. So in this case, now obviously because it's selective isolation, but not selective isolation, it's partial isolation.
Yeah.
If you are going to claim and they are accepting the 8304 code, what would you do for an Optragate case?
How do you mean, what would I do for an Optragate case?
So if you are wanting to charge it for, are you gonna put this particular tooth that you've actually used it on as such?
Yes. Yeah.
Okay.
First prize, in my opinion, is always a OptraDam. If I can grab a OptraDam, I always resort to my OptraDam first. In cases that I'm not able to use a OptraDam, I will then fall back onto my Optragate. But to be honest, I think we're about 5 or 10% of dentists in the whole world that actually utilizes a OptraDam. So if you are not a OptraDam guy, I think the first step into the right direction is starting off with an Optragate, getting all comfortable with that, and then going over to the OptraDam itself.
Okay, there was just a comment on the side there from Mohammed. With OptraDam, there's no tooth number required. That's one of, well, I've had to utilize that tooth because that was one of the rejection codes from GEMS, that
Yeah.
no
Okay.
tooth was
Priyesh,
specified.
I will come back to you
Yeah, okay, no
with
problem.
regards to those medical aid codes. You can just pop me an email myself. Like I said, I've never actually worked in a medical aid practice, so I'm not familiar at all with how the claims work, how the dealings go. So sorry about that.
Okay, cool, no problem.
Hi, will you be able to show us the OptraDam?
Yes, well, I've actually got everything right next to me. So for the guys that would like to stay on, you're more than welcome. I'll quickly cover the OptraDam. For those guys that have seen what they wanted to see, thank you very much for your time. I really appreciate it. And if there's any suggestions of topics that you would like us to cover, please send in an email to info@ivodent.co.za, or my personal email is just clinical@ivodent.co.za. Please get hold of us. During this time, we're all working from home. So this is Ivodent from Stephne's home. We'll see to all your requests, and together we'll help each other. Yeah. Just want to get everything ready here on my side.
Okay, Andre, if you'd like to ask your question, unmute yourself and ask your question while Stephne is getting ready. You're welcome to, Andre.
Okay, I'm ready. So, an OptraDam comes in a little paper bag like this. When you open it up, you'll see that I've got a blue rubber OptraDam Plus looking like this. So it's exactly the same as an Optragate. I've got my front ring and I've got my back ring. The only difference is I now have my rubber dam connected to the back end of it. So we're not forgetting the basics of our Optragate. The way that we inserted the Optragate remains exactly the same like with the OptraDam. So grabbing your figure of 8 in the Optragate and inserting it, it's exactly the same with your OptraDam. So the front is the open end, if you have a look at the side there, and then the back end is the one with the rubber dam. So what is going to happen is this is going to sit in your mouth like this with a rubber dam sheet already into the mouth. So there's no longer needed for a rubber dam frame. Okay, so you all saw the little rubber dam indexes at the back of this OptraDam. So I've already punched holes in the first quadrant. What I will do now is I'll do the second quadrant. I've got a little model here as well. So I hope you are able to see. I just want to repeat again. On the right-hand corner of your screen, you'll see there's an option of speaker view or gallery view. Please switch to speaker view, and then you'll see that my screen appears as the full screen of your computer screen. Okay, you still need a rubber dam punch. The punch with a sharp edge at the top, and it's got a little wheel here that you can actually turn to select the size that you want to pierce. So this instrument is actually a Medici product, and it's also available from Ivodent. So if you don't have a rubber dam punch, many old practices have all these things in that file 13 bottom drawer, but if you don't yet have one, we can also sort you out with this. What I then do, like with the normal rubber dam, I put my rubber dam punch. I'm going to work backwards so that you guys can see. So if I like squeeze around from the side, it's just so that I can see as well. So I put my punch through the front end. And if I'm going to be working on this, let's just do a simple restoration. Let's do the 2-6. And I've got an MO restoration here. So I'm going to punch the 2-5, or let's do the 2-7 to 6-5, and then we can do a proper restoration. Okay. So what I will do is I'll pop my punch over. I'll punch tooth 5. Oh, I'll just set it off there. I don't know if you guys can see. I'm working behind here. There goes tooth 5, 6, and 7. So all I did is on these indexes that is given by the OptraDam, I've just punched my 3 little holes there. The theory behind an OptraDam and why it is significant, it's designed so that the back end of this rubber dam is actually a 3-dimensional piece of rubber. So you'll see there's quite a bit of lax on this. So it doesn't have that continuous outward pull of your rubber dam that's connected to your rubber dam frame. When you're working in the anterior region, it's no need to use your clamps. You can just put the rubber dam like an Optragate into your mouth and use your fingers to get the OptraDam over and then floss and secure it in between the teeth. When we're working in the posterior region, however, personally, I still use my clamps. It just works so much easier for positioning. Okay, so if we're working up on the upper 7, the only clamp I've got here is a 12A and a 13A. So we're going to fit this one on the 7. Sometimes it's a little bit difficult, but let's go for it. So next what I'm going to do is I'm actually just going to be inserting. So on my rubber dam clamp, you guys will see that it's actually got little wings. So I'm just assuming everyone is using rubber dam already. So we've actually got little wings. So what I'm going to do is I'm going to attach my OptraDam around those little wings. So I stretch it slightly. You guys can see. And there my clamp is positioned. So from the front end, your clamp looks like that. And then from the back end, it's only the wings that are sticking through. I just want to close here at the back so you can only see the little metal wings. So once you've got your OptraDam in your patient's mouth, this little clamp is hanging free inside the mouth. All you then do is you take your normal clamp placement forceps, push it through the little holes. Oh, I can't see. Push it through the little holes of the clamp. You then go onto the particular tooth that you are wanting to clamp, in this case, my tooth 7. And all I do is I just clamp my tooth like that. If I pull my rubber dam away, you'll see that my 3/7 is now clamped. All I do after that is I pull my rubber dam over, and there's the hole for my 6, and there is the hole for my 5-2. Okay, so this is a whole lot easier when you've got a little bit of saliva in the mouth and you've got an assistant. Next up.
Is that the right way around, or is it back to front?
Again?
Is that back to front, or is it the right way around?
It is the right way around. It's obviously not a mouth. It's just a little little model. So this outer ring will be on the outside of the patient's lips and cheeks. And this,
I mean, is the clamp the right way around?
Well, sorry, I'm working here from upside down and back to front. I see what you are meaning. I'll just swap the clamp around here. Oh, I'm not seeing what you are seeing. Okay, so let's do it the right way. I put my forceps into my little clamp, and I then clamp my tooth to 7, right like that. Okay. So wanting to put it around that way, that's absolutely perfect. I then pull it to expose my teeth as well. So that you guys can all see. And then what we do is we actually just floss in between the teeth and secure your rubber dam. What you will do next is these little rubber dam, the part of the rubber OptraDam is still stuck on the clamps. Once we just flick them off the little clamps, you'll see that the dam very nicely and evenly isolates right around the tooth there. Okay. So even though this just looks like a little rubber dam, it's actually an Optragate. So there's my outer ring, and there's my inner ring that will be sitting in the deepest part of the sulcus of the patient. There we go. It is a little bit tricky to show on a camera when I'm trying to see what the screen sees. If there's any further questions or someone wants a personal Zoom session, we can always do that as well. Else, would you like me to repeat it again?
Maybe you can take this to the table there. Candace.
I can just say that I was knocked out of the meeting just now. Just to comment on the coding. As far as I know, there is a consent form that you can set up with your patients that if these things aren't paid by, or covered by the medical aid, that the patient is willing to pay for it. So they must just be, you put it down as a consent prior to treatment. They sign for it, and they know you're going to use these kind of products. It's not covered, and then you are allowed to charge it, because after all, you decide on the treatment and not the medical aid.
Yeah. Thank you very much, Andre.
Can your assistant come back? Then you can show us how to do an anti-tooth with floss on, please, on him. How to put the OptraDam on him, please. Thanks.
Absolutely. Please pop me an email, clinical@ivodent.co.za. And once we all get out of this lockdown, we can definitely do that.
Hi, Stephanie. Priyesh again.
Hi, yes, Priyesh.
Quick one with regards to the orientation. Obviously, sometimes OptraDam sheets do tear.
Yes.
Especially when we're doing it normally. Is there any way possible that you could maybe advise placing the dam first and then maybe using the clamp?
Oh, so you're saying that you are battling to get the OptraDam over the clamp. Always, when you order just normal OptraDam sheets, always go for the firm ones. They work a lot easier.
I'm using that purple nitrile one at the moment.
Okay. You actually get quite a nice gray one, or the black ones. I'm just not sure what the company of that is. Those are nice thick ones. So they're actually thick OptraDams. And we always try to make the hole too small. If you have a look on your punch, there's actually various sizes that you can select. Just switch it so that your punch punches a slightly bigger hole in, and then you can get it through relatively easy. So
to minimize the possibility of tearing that actual OptraDam.
Yes.
Any
tricks? Tell me that the OptraDam sheets that you are using, have they already got the little dots on in the correct place, or are you doing a tracing?
No, I'm doing a tracing.
Okay, so when you do the tracing, always ensure that you actually make the little tooth, where the tooth holes need to be made, at the right spot. So online, you can actually download, I think Style Italiano's got a very nice one, print out a sheet from there and laminate it. And then you draw basically over that to make your little indices. Otherwise, we always, if the holes are too close to each other, or we don't have the angulation, we don't stick to the arch form, a OptraDam sheet definitely will tear. You must always just double check the orientation of your OptraDam clamp, that it also follows the arch form, that it's not like sitting skew and you're like, oh, let me just try it. I'm in a rush here. I'm already late for my next patient. Just take that one step back and then you can really work faster.
Okay. Sorry, last question, Stephanie.
Yes, no, absolutely, Priyesh, thanks.
Sure, no problem. You clamped now, so you isolated 7, 6, and 5. Is there any chance that you need to put some wedge or something on the medial aspect of the 5 just to hold it in place?
Well, if it usually slips in quite nicely, and because of the bulge of the tooth, it does tend to stay in place. If you have to, it's not a product from Ivodent. You can get it from either Dental Warehouse or Milner's. It's called a widget. It's little elastic. It's like elastic floss. You can always use something like this, or a very small wedge, or even a little bit of floss. Just floss some floss through, and then take the other end and floss it through again. So then you've got 2 pieces of floss securing your OptraDam in that position.
Okay.
Can I maybe make a comment on that, Stephanie?
Yes, Lawrence, more.
The other thing you can do with that to secure it is if you take one of your OptraDam sheets and you just cut it into strips, and then you floss that strip in about a 2 centimeter piece, 2 centimeter by about 8 millimeters. Floss it through, and that will keep it in place.
Okay, genius tip. Thank you very much for sharing.
Welcome.
Any other further questions?
He says, can you do that trick on both sides?
Well, you're going to be having your clamp on the one side. So if you are wanting to secure the rubber dam under the most distal clamp, sure, you can always put something in that, but the clamp is there to secure the rubber dam at the furthest end. There we go. Any other further questions? I'm sure you are all already ready for lunch again, eh?
Sorry, Stephanie. The trick, is that referring to what I shared, what you shared now, what I shared regarding the rubber dam strips? Is that the trick?
Yes.
What are?
Yes, he was referring because now we are inserting the little rubber dam or the piece of rubber dam floss between the 5 and the 4. He's asking, could we secure that between the 7 and the, or I mean, obviously the 7 is the most distal tooth here. So in this case, we're not doing it. I would like to listen to what you want to say.
When this especially works well when you're doing anterior. When you, for instance, just want to do it 5 to 5, you're going to work on maybe on 3 to 3, or you're going to work on multiple anterior teeth. You would, for instance, slip it between the 4 and the 5, the rubber strips on both sides, and you can do it without clamps, and you still get nice retraction. You don't have to numbus as much as you would for the patients there, so it's more comfortable for them in the sense of injections also. So you can use it both sides, but not if you're going to work posterior. It's both sides is mostly for when you're going to work anterior.
Yeah, thank you very much. I hear a comment here. I just see a comment. Can you cut a hole in for suction? I actually forgot that part. Yes. So the easiest is just to grab on the quadrant that you're not working on. Just grab it with your tweezer, and then you just cut around the tip of the tweezer head. And that forms a very nice hole for your slow and fast suction to go through there. The patient won't be salivating as much as if you are working on them without a rubber dam, okay? So there's a lot less irritation to their tongue. The salivary flow is much less. So the moisture or the water that actually pools up inside their mouth is only their own spit. There's very little from your 2-in-1 or your drill or anything like that. An additional tip that you can even do with all our bleaching kits, we always get like that Ginger Guard or Ginger Protect or a OptraDam seal. You can also, for additional isolation, use that Ginger Dam around all the margins of your tooth rubber dam interface, and that seals off all moisture seepage, gingival crevicular fluid seeping up from the bottom. So also a nice adjunct if you're really getting into your rubber dam. Anything else? Any other additional questions or remarks? Are we done? There we go. Thank you very much, everyone. On behalf of Ivodent and Ivoclub Ivodent, good luck for the time ahead. Keep yourself busy and have fun. Spend good time with the family, and let's all stand together. Thank you very much.
Steph, just before you go,
Just say that we do have some samples of the OptraDam if people want.
Okay, we actually do have samples that Gary very generously made available. So if any of you guys are doing any emergency treatment during the COVID period, please let us know. RTT is running for essential deliveries only. We're more than willing to drop off some sample packs free of charge that you guys can use to protect yourself, protect your patient, and to protect your assistant during this time. And then also just to mention again, Dr. Mark Bowes will be on Tuesday, this coming Tuesday, the 7th of April at 11 o'clock. And it's sure to be some good informative information.
Fantastic, well done.
If any of you want to be on a WhatsApp group to be alerted to and sent the links, For those of you who aren't, please just email info@ivodent.co.za with your cell phone number, and we'll add you to that WhatsApp group. And it has been set for admin only, so it shouldn't be too noisy for you.
Great. Thank you very much, everyone. Have a good day.
Thanks, Stephne. Well done.